Great. Welcome everyone to this evening's engagement event around the surge testing that we're doing across the city around the new variants. My name's Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I'm delighted that we're joined by several of the ward members for the affected areas of the city who are with me tonight as well. So I think actually if I start just by asking the councillors to come in and introduce themselves so that those watching can see who is on the call. And I'll just go in the order that I can see people in my screen. So if I can ask Councillor Cotton, if you're able to just turn on your camera and introduce yourself, please.
Hi everybody, Councillor John Cotton, one of the two councillors representing the Glebe Farm and Tarcross ward.
Thank you very much. And if I can ask Councillor Mariam Khan to come on next, please.
Hi everyone, I am Councillor Mariam Khan and I represent the Alum ward. I'm one of two councillors who represent Alum. Thank you.
Thank you. And if I can ask Councillor Bridle to go next, please.
Hello everyone, I'm Councillor Marge Bridle and I'm the Glebe Farm and Tarcross ward, along with my colleague Councillor Cotton.
Great, thank you. And if I can ask Councillor Idris to go next, please.
Councillor Mohammed Idris, one of the two councillors with Mariam Khan, Alum ward.
Thank you very much, councillors. Now, if I can just go through some of the officers that are on the call, just to introduce them. So first of all, if I can ask Madupe to pop your camera on and introduce yourself, please.
Good evening, everyone. My name is Madupe Amonijo. I'm one of the public health consultants here working with the comms and engagement team.
Thank you. And if I can ask Karen Cheney to come on next, please.
Good evening, everybody. I'm only on just to make sure the meeting has started, so I won't be staying, I'm afraid. I've got to go to another meeting in 5 minutes, but I'm head of service for something called Neighbourhood Development Support Unit, and we've supported public health to put the meeting on this evening.
Thank you very much, Karen. And I know that Beverly, your colleague, is here supporting us with the meeting tonight as well. And then I think we've just got Karen Huxtable, if you'd like to introduce yourself, Karen. You're on mute at the moment, Karen.
Good evening, I'm Karen. I'm just supporting the team today with information for you.
And Karen totally undersold herself there. So Karen is a really important part of the team that are leading the testing in the city and helping to coordinate the testing approach as well. And if I can just ask Pat White to introduce yourself as well, and then we can start the meeting.
Good evening, everyone. Pat White. I work alongside Karen Cheney in the Neighbourhood and Developmental Support Unit.
Thank you. And I'm awfully sorry, Amelia, I forgot you. Do you want to just introduce yourself as well?
Of course. Hello, everybody. My name is Emilia Kwiatek and I'm supporting Karen with this meeting today, and I'm working for business support team. Thank you.
Great. Thank you very much. And thank you for colleagues for joining us today. What we're going to do is run through a short presentation to give you an overview of the testing that we're doing across the city. I know many of you have joined us with a particular focus on Alum and Glebe Farm and Tarcross, but we're also going to touch on some of the other areas of the city we're testing in as well to give you a good overview of what's going on. So I'm going to share my screen now to show you the slides, and we'll try and answer some of the questions that have already come through. but do ask your questions in the Q&A box so we can answer them after the presentation as well. So can I just ask Councillor Cotton, can you confirm that you can see the slides for me?
Yes, I can see those.
Brilliant, thank you very much. I'm always nervous when I do this, that I'm talking and no one can see what's going on. So I thought I'd start by just giving you an overview of where we are in terms of the current picture of coronavirus in the city. Overall, we are seeing numbers coming down, and that is really good. However, over the last week, that rate of descent has got a bit stuck. And we've seen a small increase in numbers, particularly in school-aged children, but also in people aged between 35 and 44. And some of that's about people getting out and about more as we've gone through the relaxation of the first step in the roadmap out of lockdown. But we're also looking very carefully to keep an eye on if this is being driven by new variants. And that's why we're doing some of the additional testing that we are. So you will have heard in the media people talking about variants of concern. Viruses change all the time. The way that viruses work is they don't have a lot of their own material to make new viruses. So when they infect our bodies, they use the machinery bits of our cells to make new baby viruses. And because they're using someone else's kit, each time they make a new baby virus, it's slightly different. So you get lots and lots of variations in viruses, and most of the time that makes no difference at all. But occasionally we get a variation that either makes the virus more infectious, or it puts more people in hospital or kills more people, or it means that the vaccine is unlikely or less likely to work, or it might do a combination of those three. And when we see a variant of the virus, of COVID virus appear that does one or more of these three things, then we call it a variant of concern, and we take additional action to try and stop it spreading. If we see a new variant of the virus emerging that looks like it might be doing these things, but we're not 100% sure yet because we just haven't got enough data, it's too new, then it's called a variant of interest. And at the moment, there are three major variants of concern globally and one new variant of interest. So the three variants of concern, there's a variant that comes from Brazil, and that's more infectious, and there's some suggestion it may put more people in hospital, but the vaccine does seem to work against it, which is good. We don't have any cases of the Brazilian variant in the city at the moment. Then there's the UK and Kent variant. So in the UK, we call it the Kent variant, and that's the version of COVID that appeared just before Christmas in Kent. And now that accounts to about 99% of all new cases in the UK. So it's our dominant strain. It's almost like this is the normal version now in the UK. But in other parts of the world, they haven't got it yet. And in Europe, where they are very much entering a third wave of the pandemic, it is being driven by this new UK variant. So we call it Kent, the rest of the world calls it the UK variant. And that's more infectious, but it doesn't seem to send any more people into hospital, and the vaccines still work. The third variant of concern is the South African variant. Now, the South African variant appeared in South Africa. The cases that we have in Birmingham at the moment are the South African variant, and the South African variant is both more infectious and it looks like it puts more people in hospital. And although the vaccines still work in that they stop you dying and they stop you ending up in hospital with the South African variant, there is some evidence that they're not quite as good at stopping you actually catching the virus and being able to pass it on. So the South African variant is probably the variant that we're most worried about at the moment. And that's why we're doing all of this additional work to try and look at where we have cases of the South African variant where someone hasn't been in South Africa or other countries where there's been lots of South African variant about. So that's why we do this additional surge testing, because we've got cases of the South African variant that just don't link up to anyone getting off a plane. The other thing I thought I'd just mention is the Indian variant. So at the moment, there may be more than one variant in India, and they're currently classified as variants of interest because we just don't have enough data yet to be able to be clear on, is it more infectious, is it killing more people, does it affect the vaccine confidence? And I'm sure that will change over this week. We're all seeing on the news how devastating the spread of this new variant in India is at the moment, and I very strongly suspect that it's the same variant that was causing the rapid rise in cases in Pakistan a week or two ago. So I expect that will change to be a variant of concern. And at the moment, we don't have any cases of the Indian variant that haven't been linked to someone getting off a plane. So if we know that someone's come from a country where we have these variants of concern, then we manage that with them quarantining, their household isolating. We do additional contact tracing if they have been out when they shouldn't have been because they've come off a plane, so they should be isolating at home. But in general, we don't do any additional testing because we know where they got it. They got it from the country that they've travelled from. Where we have to do more is when we find someone who's got this variant, but we don't know where they got it. And that's where we do the Operation Eagle response. And you'll probably remember we did the first one of these in Birmingham back in February down in Franklin. And the idea of the Operation Eagle is we're focusing on trying to identify any other cases of South African variant in the local community, because the person who's got it has to have caught it from someone. It is very, very unlikely that the exact variation that we see in South Africa appears by chance in the UK. It's not impossible, but it is unlikely. So the first step we've got to do is try and find out where have they got it. And if we can't connect them to anyone who got off a plane, then we have to do more testing in a particular geographical area around where they live, and sometimes around where they work or where they go to school as well, to try and work out, are there any other cases, and try and find them so we can try and join up the pieces of the jigsaw. We do that using the PCR test. So this is the test where you put a swab in your nose and your throat and it gets sent off to the lab. And the reason we do that rather than the rapid test that you do at home is that the PCR test is very good at finding small amounts of the virus. And also the lab machine needs to go to the lab so we can put it through the extra machine that looks at the genetics of the virus and tells us whether it's South African or whether it's UK COVID. So that's why we need to use the PCR tests that go to the lab rather than the rapid lateral flow kits that people use at home. And what happens is those tests go off to the lab, people get their results, whether they're positive or negative for COVID, within about 24, 48 hours. And then if it's positive, it goes on to a different lab machine and we try to work out if it's South African variant or not. And that normally takes about another 7 to 10 days. If it is South African variant, then Public Health England will get in contact with the person and they will go through their history. Have they been on a plane, and try and find out where it might have come from as well. So that's the approach with Operation Eagle. We're trying to saturate an area, define geographical area with extra testing to try and find where did the person that we know had South African variant, where could they have got it? And we roll out that testing through a couple of different routes. So we do door to door, where we knock on people's doors and say, would you like a test? We drop off the kits and then we come and collect them, usually either within an hour or two or sometimes the next day as well. People can also book tests through the symptomatic testing sites, so the PCR testing sites, and they can tick the box that says asked to by local government or by public health. We're also working with businesses so that businesses can order kits and we drop them off at the business and then we pick them up the next day from the business as well. And there are also places where you can drop the kits back to. We focus on testing adults, although anyone over the age of 16 can do a test if they want to. Children in schools, because they've been testing really regularly, it would be unusual for them to have it and not to have already been picked up. And so that's why we're not proactively going into the schools and doing extra tests on the children. But if you do have children in your house and you want to be extra safe, then you're more than welcome to test them as well. We currently have 3 areas live where we're doing Operation Eagles, and they link to a small number of cases. So Operation Eagle 2 is in the area of the city to the north west near City Hospital and New Spring Street Park, and that's where we have an individual. It's the same individual that caused the Operation Eagle in Sandwell. They happen to live in 2 houses, and because of that we need to do testing in 2 different areas. Then there's Operation Eagle 3. Again, this links to a single person where there's no travel history, and that's the area that's on the border between Alum Rock, Glebe Farm and Tar Cross wards. And then there's a 4th area that's just gone live, which is in Bawdsley, Highgate and Ladywood. And that's where a household, so there are 2 individuals in the house who've tested positive for the South African variant, but again, there's no travel history. And I've done some rough maps. I would say my skills with PowerPoint are limited, so the box is not a perfect outline of the area that we're testing, but it gives you a sense of the geography. So in the area that we're doing in Drury Quarter and Soho, this is the area roughly within the box where we're testing. And in fact, the bit that we're not testing is the bit where it says Winston Green and Mary Seacole House to the north of the canal. That's outside of scope, but everything that's on the island around City Hospital and the houses that are to the right of that island around New Spring Street Park, we've been working over the last week, knocking on people's doors, offering them tests, but also contacting the businesses in the area to get testing kits to their staff. The area in Alum Rock, and again, this is not a perfect, the square is not perfect, but it gives you a rough idea of the zone that we're covering, is we're focusing on the area that goes from the Naseby Medical Centre in the west hand side, along Alum Rock Road into where it becomes Cotterell Lane, up to the double roundabout, and then to the north, the railway track is kind of the border, or the south end of Ward End Park. And again, we've been rolling out door-to-door testing, dropping off testing kits, picking them up. We're also been contacting businesses in the area to offer them testing kits. And you can post those kits back, or you can drop them off at Ward End Fire Station, where there's a unit that's set up to receive the kits as well. And then the latest area that we are testing in is the area in Bawdsley and Highgate and Ladywood. And again, slightly enlarged square, but the area is roughly the area from Moonlit Park across Bristol Street down to Central Mosque, and then going to the north to the bottom end of the Chinese Quarter Gay Village area. So it's probably more of a half moon shape rather than this lozenge, but unfortunately my PowerPoint skills are limited. And on the website, we have a postcode checker on the council website where you can check your postcode to see whether you're in the area or not. If you're a business in the area, then we'll ask you to go onto the council website. In the COVID pages, there's a news item on the surge testing, and there's an online form where you fill in your details, and we aim to get the kits to you the next working day, and then we collect them the day after. So because we have to collect the kits the day after, we only deliver Monday to Thursday and we collect Tuesday to Friday. So if you put in an order tomorrow, then you'll get your kits on Friday. But if you don't order till Friday, we don't deliver them till Monday. And that's because they have to go back to the lab, and the lab collection route doesn't work at the weekends, unfortunately. Which is slightly frustrating, but it is unfortunately what it is. And the form we use, is very simple. We just need to know the name of the organisation, who the contact person is, the date that we can deliver and the date we can collect it from. So it's very straightforward, and we found in Frankly that this was an incredibly effective way of getting kits out to workplaces, because we really want anyone who's been in these areas, either lives in the areas or has worked in the area in the last month, to do the tests. So that's the kind of window that we're looking at. And what we're hoping to achieve through all of this extra testing is that we will, first of all, identify any cases of COVID where people may not have symptoms, but haven't tested recently. And secondly, where we do find those cases, to try and work out, are they South African variant or are they normal UK COVID? And if they are South African variant, does that help fill in the gaps about how these people might have caught this variation of the virus? So I hope that's helpful in giving a bit of an overview of the approach we're taking. And I think probably if we move to some of the questions now, then we can take those. But just before I go to the questions from the audience, I wonder if there are any questions that any of the councillors want to raise about how we're doing this or what's going on.
Justin, it's Councillor Bridle here. Would it be possible for John and myself to have a copy of the map that relates to the end of our ward that links up with Alum Rock, so we can just see that in a bit more detail? Thank you. That could be emailed to us. Thanks very much.
Yes, we are. There is going to be a more detailed map we're trying to get up on. There is going to be a more detailed map we're trying to get up onto the website at the moment. I have to say, through the Operation Eagles, I've learnt a lot more about postcodes in Birmingham and how the geography of postcodes isn't necessarily logical. People who are watching might remember in Frankly, when we started doing the testing, we talked primarily about Frankly Great Park. And then we had to talk about Northfield, because one of the postcodes had two streets that went into Northfield. And that's some of what we have at the moment. So the majority of the postcodes are in Alum Rock, but there are a small number that go into Glebe Farm and Tarcross. And that's true in all of the areas where we're doing the testing. So we're trying to make sure maps go up on the website, but we will get those circulated out to members as well in the next day or so. So if I go on to the questions, sorry, Councillor Khan, you wanted to come in.
Sorry, Justin, I realised we're using Teams Live and I was trying to raise my hand and realised I just had to speak out. Apologies. Yeah, I've got two questions. One was just, how was this variant brought to anyone's attention or identified in the first place? Because I understand that the one we're referring to within the Alum Rock Glebe area is a single case. So just a bit of understanding behind how we even know about it in the first place. And then secondly, if people in the area that we're referring to have already been tested positive in the last month, because you said we're using like a month window, if they've already been tested positive for COVID, should they be getting tested again, or would the previous test already have identified that it wasn't a case of South African variant of COVID-19? That's my two questions. Thank you.
Yeah, really, really good questions, Councillor Khan. So the reason we're finding the South African variant is across the country at the moment, between 50 and 80% of all of the positive tests are being genetically sequenced. So they're looking at the variants on the positive tests already, and that's how we're finding them. The UK does more genetic typing of viruses than any other country in the world. Currently, we're doing about 50% of all of the genetic typing of coronavirus in the whole world. And that's because about 10 years ago, people might remember there was a thing called Biobank, which was all about mapping people's DNA. And what they've been able to do is convert the technology from Biobank to looking at virus genetics. So that's how we're finding them, because at the moment every positive, or the vast majority of positive samples, are going off to the lab to be checked for their variant type. And that's why at the moment I know that about 99% of all positives in Birmingham are the Kent variant, because it's being routinely done. But because of that, we are finding some cases of South African variant, and that's what triggers these Operation Eagles. So that's how we found out about it. And that's different from when people come off the plane and they have to do their quarantine testing. So we are picking it up through that as well, but obviously that's people who are traveling. In terms of if you've tested positive, and actually if you've tested positive in the last 90 days, you don't need to do a PCR test again. So that's if you've tested positive with a PCR test. So one that you've put in the post, or you went to a symptomatic testing site. If you've tested positive in the last 90 days with the rapid test, then I would ask you to please do the PCR test. But when Test and Trace contact you to say it's positive, you need to explain to them you've had the lateral flow test before, and they will make sure that you don't go on the list that should be isolating. And the reason I say that's important is because when you do the rapid test at home, your sample just goes in the bin. So we don't know if it's South African variant or not. Whereas when you do the one that goes off to the lab, we will find it. If you've sent one off to the lab in the last month because you had symptoms and you tested because you had symptoms, then you don't need to do another test. It will have already had its genetic sequencing done. So if your positive comes from a lateral flow test, please do the PCR. And the system will know that you've already got a positive, so you don't need to isolate again if you've already done your 10 days isolation. If you tested positive with a PCR because you had symptoms, then you don't need to do it again. Hopefully that makes sense, Councillor Khan. I saw you pop up, but you're muted, Councillor Khan, so
apologies, it was just a thumbs up. That does make sense. Thank
brilliant.
you. Thank you.
That's the challenge of live, is it's hard to see everyone. I'm not sure, Councillor Idris, were you looking to come in there as well?
Yes. Have you got any figures as to how many tests have been carried out so far, and what is the time scale? You know, as to what are you going to make sure that everybody's got tested, or what is in mind? You know, how long it's going to carry on?
I'm just waiting for the live box to come back across. So at the moment, I don't have the figures for the different Operation Eagle areas. From the memory, though, we're into the hundreds of tests that have been completed. And given we only started a couple of days ago, the aim is that we will continue to offer testing for 10 days. So in Alum Rock, we'll be continuing to offering testing probably till about the middle end of next week. In Bawdsley, it'll go on a bit further. In the Soho and the Drury Quarter, we're finishing on Saturday. So, and we will start to get the results through from the Alum Rock tests. I would expect to start to come through actually probably tomorrow and the day after. We'll start to see the first numbers. We've seen the numbers from Soho and the Drury Quarter came through on Monday, and they did their tests last week. So there's a bit of a time lag, but we're already in the hundreds, which is really good news, actually. And I'm really pleased because I think everyone knows the challenges we've had around vaccination uptake in Alum Rock particularly, and it feels like the community is really engaging and working with us on that, which is really good news. So, but we will be able to provide, and perhaps if we provide elected members with the details after the bank holiday, I'll be able to give a readout of uptake in your wards, and then you can share that with constituents. Maybe a good way of doing it. Councillor Khan.
Sorry, I've got one more question, if that's okay. So if somebody did a rapid test and they were tested positive, but it was, let's say, about a month or so ago, they're okay, isolated, gone through all of that, and it turns out that it would have been the South African variant, but because it was rapid and it was just thrown in the bin and it wasn't picked up and gone to the lab, will the current PCR test even pick that up, or would that information, I mean, I suppose it would be relevant because then you could trace where they've been, but would it be too late for that to be picked up if it's, I don't know, 30 days ago? Does that make sense? Okay.
Yes, absolutely. So for the PCR test to work, it only needs a very small amount of the virus on the swab. For the genetic testing, it needs a little bit more. So if you tested positive a month ago with rapid test, then the PCR would still be positive, and there should be enough to be able to know whether it was UK variant or whether it was South African variant. If you tested positive, let's say, where are we now? April, February, March. So if you tested positive in January, then it's too far out now. It's too late. So really, if you've tested positive in the last month or so, then please do the PCR, because we should still be able to find it. If you tested positive 8 weeks ago, then your PCR will still be positive. It's less likely there'll be enough of the virus for them to be able to genotype it, but I would still do the test because it helps us. And most people who have a positive with the rapid flow tests, the rapid test, should be getting a PCR test anyway now. So it'll only be a very small number of people who've only had a lateral flow test that tests positive. And for them, it's worth them doing the PCR just to check it's not the South African variant. So hopefully that makes sense. I thought if I pick up some of the questions, and I just wonder whether Modupe, you can pull out some of the ones that you think would be really good for us to pick up.
I can do. Would you like me to read them out?
Yes,
or...
I think if you could, that would be really helpful.
Okay, so thank you very much for that helpful presentation, Justin. And I've been listening intently and reading some of the interesting questions here as well. There's one from, I don't know if we should mention names, but names are coming up. Okay, so from Mukhtarim Shah, thank you for your question. Is the virus starting to spread again because of the South African variant?
Yeah, so interesting question. I don't think it is in the UK. So I don't think the rise that we're seeing in cases is because we've got a lot of the South African variant. But in other countries where they don't have a lot of the UK variant, when they get the South African variant, it runs like wildfire. What's strange in the UK, and it does seem to be quite a UK thing, is that the UK variant beats the South African variant. So where you've got lots of the UK variant, the South African variant struggles to get a foothold. What we're worried about, though, is that it might, because it is more dangerous. And that is why we're concerned about it. So if you look at London at the moment, where they have got quite a large number of cases of South African variant, I think it was over 40 last week in 2 areas of London, and they can show that that is transmission in the community, that they are doing a lot of work to try and make sure that doesn't spread any further, because the real concern is that if the South African variant gets a foothold and gets a decent number of people infected, that's enough for it to start to battle its way out. And you'll remember actually at Christmas, we were doing really well in Birmingham. And then the Kent variant came up the train line from London and our case numbers rocketed up. And that's why I am nervous about the South African variant, and we're taking it very seriously, because there's a real risk that if it does start to spread in the community, then we would see numbers shoot up as well. Whereas at the moment, they are at least steady, if not starting to come down again. So there is a risk if it gets too big a foothold and it starts to spread in the community that it will spread faster, and that will unfortunately put more people back in hospital, which we really don't want to see. So that's why we take this very serious.
Thank you, Justin. Next question is from the same person, Mukhtaram Shah. How many roads are you testing in Alum Rock area?
Now that one, I'm afraid I don't have a magic answer to on that one. I haven't counted the roads. I would say it's in the region of about 3,500 people that we're looking to test. And I think that from memory, that's just over 1,000 and a bit houses in the area. So it's probably then in the ballpark of 20 to 30 roads. And one of the interesting bits about this part of the city is the area we're focusing on is the area that's quite a lot of housing between really the start of Alum Rock High Street and doesn't go quite as far as Washwood Academy, but just before that. And you've obviously got the railway line and the park to the north, and to some extent the railway line below. So it is quite a small area compared to what we were doing in Frankley. And what we're doing with the teams is they're going around street by street. So they go around, they drop off the kits, and then they come back a little time later to pick them up. They're doing it at different times of day. So they do kind of circuits of the area. And the aim is that we will offer every house at least 3 attempts to offer a kit. So if you say no, that's fine. We don't come back and hassle you. But we want to try and get a response. So we do want to try and catch someone that's in, and they will be out over the bank holiday weekend, door knocking as well. We've been shifting so they come more in the evening rather than the middle of the day when people might be at work or at school. So it is working through in cycles to get through all of those streets. But it's not a huge number of streets, I think, in the area. I would say roughly my ballpark would be about 20 or 30 streets or so. Some of them are quite long, though.
Thank you. Next question is from Tariq Ikbak. Pharmacies are providing LFT testing, which needs promoting. Plus, we are providing kits for collections. More awareness is needed for the public. So it's not so much a question, but suggestion and advice on that. I don't know if you wanted to say anything more about that, Justin. About awareness for the public.
Yeah, no, I'll pick up on that. And thank you, Modupe. And thank you for the question. I think, firstly, it's really important to say in this type of testing, we're doing the PCR test rather than the lateral flow test. So it is important that people keep going with the lateral flow test, keep doing your twice a week testing. And you're absolutely right. People can get these test kits, as you say, Tariq, from local pharmacies, and we are trying to promote that more. I was actually on one of the local radio stations last night with one of our COVID champions talking about this, and that's one of the ways we're getting messaging out. All of the businesses in the city should have had an information pack on what they can do to help reduce the risk, and part of that is promoting testing as well. But if you do have any specific ideas about things we could do drop us an email, and probably the easiest way is dropping that email through to publichealth@birmingham.gov.uk, and we can pick that up, or you can email me directly and I'll pass it on to the team as well. But it is really important, once we're through the surge testing, that everyone does the regular testing with the rapid tests. And we've also been talking to local businesses. I'll just pick up the point that Mohammed Amin put in the chat. We have been encouraging local GPs to promote the operation. We've also talked to local pharmacies. We are talking to local businesses about would they be happy to be collection and drop-off points. And unfortunately, at the moment, no one's come forward and said yes. So if you do know of any local businesses, or you run a local business and you'd be happy to be particularly a drop-off point, then do let us know, because that's one of the things we want to try and do, is increase the places where people can get these kits. We've also been putting out the COVID marshals a little bit more in these areas to make sure that people are wearing their masks, that the shops are doing the right things, and we're all doing the right things when it comes to behaving and not crowding the spaces. So there is quite a lot of activity. Some of it you'll see because people will be in high-vis vests, but some of it you won't yet.
Thank you, Justin. Another common theme actually around getting involved and how we can help this operation. So Beth, NNS project support worker, has also asked how local community organizations can help to distribute the tests, and Beth is from the Bodsley Highgate area. So I think you've answered that as well. Thank you very much, Beth, for that offer, and please do get in touch. We do have another one from Tariq Ikbak. Would you say that our areas have fallen behind on testing of the public? Have you visited and seen shops where masks are not being worn and there are queues? So do we think we're falling behind on testing?
Just waiting. There we go. The live's coming back. I think, yeah, I would say actually Alum Rock struggled a little bit when it comes to testing, and I think some of that's been about access and getting enough easy access to people in the area, and we are looking at what more can we do, particularly when we're not doing surge testing, when we're doing the normal rapid testing. We've been piloting going out to local supermarkets and handing out testing kits at the weekend. We did this in Tesco's in Hodge Hill last weekend, and we handed out over 1,500 testing kits. It was really, really successful. So we are looking at what more can we do to just make it really easy for everyone to get testing. While we're in the surge testing, that's by going door to door and going at different times of day to try and catch people when they're in. But outside of this, I think there is more that we need to look at, particularly in this area. And I'll just try sharing another slide with you that I presented earlier today, which is about testing in the city. So if I show you this slide, which you should be able to see. So these dots are places where you can pick up lateral flow kits in the city. And the blue squares are mainly pharmacies where you can access testing kits. And you can see there's a reasonable coverage actually in the kind of Alum Rock area. It's not perfect, but it's not too bad in terms of numbers. When we look at testing uptake, and that's the map on the left here, this blue map, the area of the city that has the lowest testing uptake, which is this kind of greyish colour or lightish blue colour, is some of Alum Rock is in this area. It's the kind of central stroke east band of the city. And although that's improved a lot compared to 2 weeks ago, it's still not as good as the rest of the city. So we are looking at what else can we do to try and encourage people locally to test, because the more we test, the more we find cases, the more we stop the spread of the virus. And that's the key thing. You know, this asking people to test is not about because we take any great pleasure in getting everyone to stick swabs up their nose and in their throat. It's because this is the way that we stop the spread of the virus. So I think there is more we need to do, and I'm very keen to continue to work with the community in Alum Rock to drive up the testing rates. But you know, I think we're getting better, and hopefully through this surge testing we will see numbers coming up more. And as I said, if people have got more ideas about sites where we could do testing, then please drop us an email. I know Tarek's offered, because he's got particular links with local pharmacy, and I've messaged him privately so he can connect with me on that, because I think it's a really important opportunity to think about how we can drive up testing in the area and maximise the assets that are there, because I think that's really important at the moment.
Thank you, Justin. I was going to pop the COVID Champions email address there as well. I've just popped it over to Beverly so that everyone can see that and sign up to be a community champion. Virus lives on a host. Lovely name, actually, quite apt. Has a question. How reliable are the tests, and which is the most reliable in detecting the virus?
Yeah, it's a good question, actually. So we have two different types of tests. We have the lateral flow test, which is the rapid test, and the PCR test, which is the lab test. And they both work based on swab to the back of your nose, back of your throat. And the PCR test is the one that gets sent to the lab, and that is more accurate at finding very, very small amounts of the virus, because it goes into basically a lab machine, takes usually a day or so to get a result. And it's very good at finding very, very small amounts of the virus. The slight challenge with that is what it's not good at is telling you whether you're infectious or not. So a positive PCR test says you've definitely got COVID or you've recently had COVID, but a PCR test will stay positive for up to 90 days after your infection because it's finding even really tiny bits of the virus. Now, the rapid lateral flow test that you do at home is obviously it's using just a bit of special paper in a little plastic kit. And it's very good at finding when you've got lots of virus in your nose and your throat and you're most infectious. And the lateral flow kits, when in terms of finding people who are infectious, are between 85 and 90% accurate. So they're very, very good at finding, are you infectious or not? What they're not very good at is finding when you've only just caught COVID or when you're getting over it and you're not as infectious anymore. And that's where the PCR is much better in the early days, where you're not infectious yet. You might have symptoms. You don't know whether it is or isn't. So that's why we use the PCR for people who've got symptoms. And the reason we use the lateral flow twice a week, because if you test every 3 to 4 days, you're likely to catch someone at a point when they're just starting to become infectious. So that's why we have to test more frequently with the lateral flow. Unfortunately, there just isn't lab capacity in the country for everyone to do PCR regularly. In many ways, I wish there was. It would be a lot less swabbing. We wouldn't all have to be doing this twice a week. So that's why we're not able to use PCR for everyone, although it is a more accurate test for infection. Lateral flow is a very good test for infectiousness, and that's why we use them slightly differently. So hopefully that makes sense. And when we're looking at the variants of the virus, the PCR test is not the test that's looking for the variants. It's trying to find, is there COVID or not? They then use a different machine, which basically looks at the virus under a very specific type of a microscope, in a sense, to map its genetic code. And that machine is very accurate in terms of saying, is it a South African variant or is it an Indian VOI? Or is it a Brazilian variant? So that machine is very good, and we don't see cases where people are told it's a South African variant and it turns out not to be. That machine is very, very accurate. But unfortunately, it takes a long time to work, which is why we don't get the results quickly.
Thank you, Justin. There's another part to that question from Virus Lives on Host, which I'm trying to understand. I think there's perhaps a word missing there. It sounds like the question is, do you see tests that are positive that are false sometimes? So the ones that are like false positives, I'm not sure if that means tests that have been done for the variants of concern. Do we have those coming up as being false positives, as we say as well? Do we know?
Yeah, so let me unpack that a little bit. First of all, the lateral flow tests and the PCR tests work for variants as well as for normal COVID. So you don't get more false positives or false negatives with the variants. It doesn't make a difference. And that's because the tests are really looking at the surface of the virus, and they're looking at the big signs on the surface rather than the little changes that happen in the variants. So the tests both work, both PCR and lateral flow are still the same effectiveness in terms of finding COVID, whether it's new COVID or old COVID or South African COVID. So I think that is important to stress. No test is perfect. There is no test in medicine that is perfect. So these are very good and actually much better than I think we were expecting earlier on in the pandemic, provided you look at what are they trying to tell you. So PCR, very good at finding small amounts of the virus. Positives in PCR are usually very accurate, and there's a small amount, less than 5% of false negatives. The lateral flow, slightly different, and it does depend a bit on how they're done. So people can be, don't always get them right, but lateral flow, false positives are rarer, but they're not unheard of. And that's why we do the PCR follow-up. But the other reason we do the PCR follow-up is to check whether it's a variant or not. So that's why people who test positive with lateral flow are asked to get PCR. False negatives with lateral flow are more common. And this is why when we talk about the lateral flow test, they talk about it being a red light test rather than a green light test. So doing a lateral flow and it being negative does not mean you can rush and hug your granny, because they do have unfortunately a reasonable level of false negatives where they tell you haven't got it and you actually have. And that's because you might be in the first day or two of infection and you're not infectious yet, or you haven't got a huge amount of the virus in your throat and your nose, so the test can't find it, but actually in the next 24 hours you will be. So that's the problem with lateral flow, and it is the limitation. So when you're negative for lateral flow, don't assume that means you can give up on the rules. And when you're positive with lateral flow, believe it, because the number of false positives are very, very rare. The testing technology is always improving, it's getting better, but they are a lot better than not knowing what's happening. And that's why we want everyone to test, because it's better to know these things than to not know them. Now, I'm really hopeful that through this surge testing, the communities will engage with it, that we will really increase testing, but also actually the legacy of this is that testing in these areas will become much more normal, because it's a thing that we can all do that makes the city just that little bit safer. You know, there's lots that's going on that businesses are doing, that they're doing, the council's doing, the NHS is doing, but the bit that we can do is follow the rules and do the testing, and that just makes everyone a little bit safer. So I think, Modupe, we've covered pretty much all of the questions, haven't we?
Yes, we have. Most of the other comments are just helpful comments and advice, which I've noted. And do join the COVID champions through the link. I've sent an email address there as well. Thank you.
Brilliant. Thank you, Modupe. And I just want to give a chance if any of the councillors wanted to share any other comments before we close the session.